Welcome to the Sharon Fitzmaurice podcast. And my guest today is Nicola Heneghan from County Mayo. Nicola is a mom, a qualified pharmacist with a huge passion for holistic health and well-being. This passion led Nicola to train in additional complementary therapies, dietary counseling, nutrition, Reiki energy therapy, and yoga. She firmly believes that it is the integration of our nutritional, physical, emotional, and mental health that leads to vitality and wellness. This has stood to Nicola, personally in the last year in particular, as she underwent surgery for stage 4 endometrosis. So, Nicola, you are very welcome today, and thank you for joining me.
Thank you so much for having me, Sharon. I'm very, very excited and honored to be on your podcast. Thank
Well,
you.
I'm honored that you're here. I've said, as I started this, and I've kind of been documenting since I started my first podcast, I really hadn't a clue technically about it. But again, like anything in life, when we hesitate or we push it away out of fear or self-doubt, we'll never do anything. And as I read your bio, I kind of feel that as well, that you've kind of went forward, with things. You could have just stuck to pharmacy and being a mom. That's enough of a job in itself, all of those.
Yeah.
But you went forward and you wanted to seek out other ways or complementary ways to help you yourself, but also the people that you're helping or working with.
Yeah.
So here we are. And as I said, every guest, it's raw and real. There's no fluff. And we'll just go in and ask really for starting with you is what led you to want to train in pharmacy?
Okay. Well, I guess you could say, Sharon, that pharmacy is in my blood. So my grandfather ran the pharmacy in Kelchmaw for years, and I grew up in the pharmacy there with him. And I always had an interest in kind of going down to the shop and helping him out. And I think actually I was the only one of the grandkids that was allowed in to help him because I showed that interest. He was always telling everybody else to get back up the stairs. And I guess I always had that interest watching him making his potions, watching and listening to the respect that he got from the community. Like I remember people we called him Gaga Michael, known affectionately as Gaga Michael in our house. And Gaga Michael would have people calling to the house at all hours of the night. Actually, I remember when we were young, because they lived upstairs above the pharmacy, and we'd call down to the house. They got sick of running up and down the stairs to let us in. So they attached a key with a lace at the back of the door so that we could slide our hands in through the letterbox and open up the door so we could run upstairs.
Wow.
And people obviously got word of this because once or twice somebody from the town would land up and at 7:30 or 8 o'clock in the evening looking for help or looking for medicine.
Oh, wow.
That's the way he was known of in the town. So that's where my love of pharmacy came, I guess. And my grandmother, he was married to Gaga Sheila. She was a nurse. So there was always that kind of health aspect growing up. Now it took me a long way, or I took the long road to do pharmacy because I guess as a teenager, I didn't want to be forced into that role and then having to come back and take over the family business. But I also didn't get the points in my leaving cert either. So
great excuse for now.
Yeah. So I took the long road to get there. I eventually went back and I studied pharmacy as a mature student. And then after I finished, I did my training in St. James's Hospital. And that was phenomenal. That was a really, really good training. Got to see lots there. Before moving back to the West, because I'm a country girl, and I guess I always knew I'd be back home to Mayo. So at that time, the pharmacy had been taken over by another gentleman, Gary, who I went and worked for him for a few years. A few years. I was there for about 8 years, I think. And I guess I loved the fact that I was being able to help people with their conditions, with their illnesses, and being a part of their health journey. Yeah. But I guess over time, and you could see people's health journey, how they'd start off one medication, that their prescriptions would gradually over the years get bigger and bigger. And I've always been one for questioning, well, why are these people getting ill in the first place? And what is it that drives them into the pharmacy? Like, why are you looking for something? Or I think in the Western world, there is this notion of a pill for every ill, and there's a pill for every symptom. So I became disillusioned, I guess, because I wasn't really working in a healthcare system anymore. I was working in a sick care system, and I just thought there has to be more to it than this. And I guess that's what kind of led me into the role of, I left that job to explore more about nutrition and to explore what that great philosopher Hippocrates, he always said, let food be thy medicine. And I said, okay, let's give this a go. So I went back to college to study. It was dietary counseling at the time, and then it evolved into nutritional therapy, and my eyes were opened then, because our bodies are amazing. And if you give your bodies the correct raw materials, no more than you service your car, you put the correct diesel in it, you bring it for its service every year. We have to do that also with our bodies. Give it the correct raw materials, the good raw materials, and your body will and has the ability to heal itself if given that opportunity. So there's a lot more than, I think when people think of health, they think of the body and they think of exercise, which is very, very important. They think of nutrition, but there's an awful lot more to health than just the body. The mind and the spirit is also really, really important, as you know. So I think you have to maybe replace that word. Hippocrates said, let food be thy medicine, but replace the word food with let your lifestyle be your medicine, I think. Because it's not just about what you eat, it's about how you eat it. It's about how you exercise, what kind of exercise you do. It's about how you move, how you breathe, how you sleep, how you nourish yourself, what you're listening to, how your relationships are. These are all really important in the whole holistic picture.
And if we go back there, Nicola, for a moment, you know, and we're going to go a little bit deeper into that, as yes, absolutely, I'm always saying it's the whole self, it's not just the physical. But do you think, as well, not just in Ireland, but in many countries, that pharmaceutical drugs have become the fix for even mental, you know, health issues, don't mind physical health issues or even emotional health issues, that it's been so programmed into us, I suppose, that there is a pill for everything. So going on that, it's like we're conditioned or programmed, you know, over the space of time, and in particular the older generation, you know, and because their health fails maybe as they get older, and you know, they think, okay, well, there's a fear around it, isn't it? And they think, well, they go to their doctor. And I think of your Gaga, Michael, you know, he was a real community man, and he was always there for the community, and people would come to him, and if they didn't go to the doctor, because I believe a lot of people didn't go to the doctor, say in my mother's generation, they couldn't afford to go to the doctor.
True, very true.
So they might go to their local pharmacist, who they would know and trust really well, a community person, and say, is there something you can give me to help me with, you know, this pain in my leg or the pain in my head, or I'm a bit down today, or whatever it is. And they became true. You know, I think it's not their fault, but it's all they knew. There wasn't the awareness that there is now, that we need to look after all parts of ourselves. It wasn't spoken about. So it's only, I suppose, even now people are still not aware of the connection between mind, body, you know. They're still not. And you'll still have people coming in and going, you know, and even as clients, they'll say, oh, well, it's this, that, and the other. But I'll say, okay, well, try these exercises, or try meditation, or try yoga, or try these things. And there's a fear around trying it because they want it fixed now. Do you believe that's still a problem, Nicola, in our day?
Yes, definitely, Sharon. I see this every day at work. I mean, since my escapades into nutrition and all of that, I still work as a pharmacist. I still work as a locum part-time. And it's great that I have these extra tools to use in the pharmacy. But when I try to use them in the pharmacy and I try to delve into, well, why do you think you have this headache, or why do you think you have these stomach problems? As you say, it's just ingrained into people's nature. They want a pill, and like, thanks for that. Some people now, not everybody's like that. Some people, I will point these things out, and they've never actually thought of it that way before, and they're very, very appreciative of it. But still, there's a lot of people that just give me the pill, please. I just want to sort it now. Just get rid of the symptom, you know. So
they don't want to. I think it is a lot of people, as I said, it's a fear, you know, maybe.
It's a fear,
yeah, what is underlying, and there's this fear of getting sick or having a disease, you know, so just get rid of it now and I won't have to think about it again. Instead of, as we would try and do, is go underneath it and say, okay, well, how long are you having this headache, or how long are you having these stomach problems? So have you tried changing your diet, or have you tried doing anything? And when you say that, you know, and there are some people that just want the pill, is there any way you see forward between, say, the pharmacy side integration within even your role as a pharmacist? You know, is there something that you in your mind have thought about that this could open it up? You know, I know you can do it outside of the pharmacy, but do you think there's things that pharmacies can do in particular to help people to grow awareness about looking after our whole self?
Yeah, well, I think one of the pharmacies that I work in Malloy's, they have a great kind of health and lifestyle section, as well as the medication section. And James Garrity, he's the owner of Malloy's Pharmacy. He's got a real passion for that side of pharmacy as well.
Brilliant.
So we have all the kind of health supplements, not just medications, and like natural foods and teas that you can use. And I think it's up to when people come into the shop, it's kind of hard, especially these days now during COVID, because things have just got extremely busy and we don't have that opportunity as much to go out to the counter and grab that person that we see we know would benefit from it. So as pharmacists, you kind of look for that. You look for the people that you can, that you know will be willing to help, and try and pull them aside. But I guess, well, especially in these days, as I said, it's kind of harder to do that at the moment. But I think that's kind of why I set up my blog. I do have a blog on Instagram, as you know, and I'm just trying to be more proactive with that now lately, especially when it comes to women's health. I do intend to blog a lot more about that, to try and target, because that's the way the world is going now. We're all on our phones, aren't we? We're all on our screens, and that's where the information is. And just in my journey with endometriosis, that's where I learned a lot of my information. It wasn't actually through health professionals or anything. It was through other people's experiences online. Yes. So that's the way I intend to go on, as well as my work in the shop. I do try to promote this stuff online as well. Yeah.
And I think it's so true. You know, we are on our screens probably too much, but as again, because of restrictions, it is an avenue almost for us to find out what's going on in the outside world. But we can read so much information that's not true. So more than your own journey, it's to, I think, research for people. And what I would advise any clients, if they're going through any kind of a health crisis, you know, whether that be mentally, emotionally, or physically, I would say, okay, so you've gone to your GP and, you know, you've gone to the hospital and this is what your diagnosis is and this is what you're taking. But I would say research as well. Talk to people that have gone through that journey like you did. Speak to them. What were their experiences? What helped them the best, you know, emotionally and mentally, but also physically? Was there anything that they changed in their diet, or was there any exercises like yoga or walking or whatever it was that helped them? So again, it's the overall picture, but we have to, the person has to be willing, Nicola, as you said, to want to do that. But I have found kind of, I suppose, in the last 12 years of my practice, is that people really only think about their health when they become sick.
Yes, that is so true, Sharon. You hit the nail on the head. You really, really do. People don't think about those things until their bodies force them to think about it. And you'll have seen that in your practice with your clients. They might come to you for something and you'll end up discussing or revealing something else entirely that has nothing to do with it. That's the way it is, isn't it? And you hit the nail on the head when you said about research. Especially these days, I think you really have to be the CEO of your own company or the CEO of your own body. You have to advocate for yourself. You have to become aware, learn how to be aware of your body and your emotions and your feelings. And it's through that awareness that you'll get that information. And information is power. Like I had another meeting with a weekend with a consultant, totally unrelated. It was something else. And in my meetings I've had with him before, and some doctors are like this. They like the sound, and no offense to them, but they talk away and they don't really listen to what you're saying. But it just came up in the conversation how I went to London for my surgery, and it suddenly stopped him in his tracks, because he said, you obviously did a lot of research to pick out your specialized surgeon, to go down that avenue. And he said, I should bring you in really to lecture my fourth year medical students. And that's the way it is, because I did. And you have to do this research and get the information, because that information is power when you do go to your GP. And that may not be familiar with all aspects of what it is with the disease or whatever it is. Yeah.
And as you said, we're going to, I suppose that's again conditioned in us. We go to somebody and believe that they're the expert and they know everything. So we're going to go into your journey in a moment, how you ended up in London for surgery. But if you only listened to what you were being told here, where would you be now?
Do you mean by my GPs, is it?
Well, not blaming anybody, but just saying that if you didn't do that research and find that surgeon, and find that there was surgery that could maybe help you, where would you be if it was only this small little bubble of information, even though that information is what they knew? But how, as you as a layperson as such, you were able to find out all of this information that maybe wasn't offered to you.
Yeah. Well, that's exactly what's happening to many women in Ireland now today, because they would go to their GP. Well, actually, in Ireland, it's an average of 9 years to get a diagnosis of endometriosis, would you believe? And that's kind of like, that's really a glaring example, isn't it, of how women's pain is dismissed in this country. And Ireland, I think, has a lot of scandal over the years when it comes to women's health. I mean, we've had the cervical smear, we've had death of Savita, the Magdalene line. We've had lots of scandals when it comes to women's health. So what's happening in Ireland at the moment is that there is a lack of specialized surgeons when it comes to endometriosis, because a lot of the gynecologists here in Ireland, their main area is really the delivery of babies. And then as an aside, they might have a half-hour surgery for endometriosis or whatever it is that they're dealing with. So if I hadn't done this research, I probably would have ended up having surgery here. Yes, they do I can never say that word correctly. A laparoscopy.
Yes.
Because unfortunately, that's the only way that endometriosis can be diagnosed, is with surgery. And surgery is a major thing that one has to consider. But unfortunately, that's the only way that it can be diagnosed at the moment. And in a lot of surgeries that they perform here in Ireland, they do the laparoscopy and they burn away the lesions that are present. So they don't excise them. That's generally what happens with endometriosis. It's ablation, which is the burning away, or there's excision. And excision is considered the gold standard treatment to remove everything. Because what happens, and I've spoken to many girls who've had, I think one girl I was speaking to had up to 15 laparoscopy surgeries here in Ireland, because it's not getting rid of the problem when you're burning away. It'll dampen things down for a time, but eventually that's going to come back. So the surgeon that I got to see in London, he deals with a lot of girls that have gone through repeated surgeries over and over to eventually end up getting the correct treatment for endometriosis. So
can you tell anybody that doesn't understand or has never heard of endometriosis what it is and how you started to become more and more aware there was another issue? It wasn't just, people talking about, certain times of the month and it's period pains and all of that. Where did it start for you? How did it affect you? How does it affect most women? And and just tell people a little bit about it. Yeah.
So endometriosis it's a chronic condition where the tissue that's present in the uterus that grows outside the uterus. So it can be found on areas outside the womb, the ovaries, all over that kind of general area, along your intestine, along your colon. It can even be found on your diaphragm, the brain, the lung. It has been found in women in those areas also. So the tissue that's present, your endometrium through your cycle, as that grows, at the end of your cycle, then it's shed. That's what your period is. And in Ireland, we hate that word period. Oh my
Yes,
God.
the
Can't
menstrual
say the word
cycle.
period. God, don't even mention vaginas. We
Yeah.
can't talk about that kind of stuff. So,
Yeah.
so that tissue is shed at the end of every month. But the endometrium has an exit point out through your vagina, but the tissue that's growing outside in all these different areas, they don't have an exit point. And they're subject to the same hormonal changes through your cycle. So they experience all that growth and shedding that your endometrium does in your uterus, but it doesn't, they don't have an exit point. So with the result that you get adhesions and scarring and lots of inflammation taking place within the body. So to be honest, even though I'm a pharmacist and I've trained in lots of areas, I didn't even know what endometriosis was before my journey. And it took me a long road to get to my diagnosis because I didn't even think I had endometriosis. My problems were in the bowel, and the only reason I went to the GP about it was because a good friend of mine recently got diagnosed with bowel cancer. So that's what led me to the GP. And at the time, it was kind of, and no offense to the GP or anything, it was just dismissed as kind of spasms. But your gut, I think you know in your gut that
Yes.
there's something more to it than that. It wasn't it. So she did refer me on for a colonoscopy just to make sure everything was clear on that end. And I did have that. I got sent for an MRI, that all was coming up clear. And that surgeon then referred me on to a gynecologist. And at the time I was thinking, what the hell is he referring me to a gynecologist?
It's my bowel.
Yeah, it's my bowel. It's nothing to do with my womb. So I had a meeting with my gynecologist. He couldn't find anything. He did all the scans and everything. Couldn't find anything either. Said to come back if things progressed. So I went away. And it was only then, the few months after that, I started noticing that these bowel symptoms were taking a pattern and they were happening around my period. But I never knew when they were going to strike. So I guess things got worse. It got to the stage where, and sorry now if this sounds like too much information, but it got to the stage where it felt like I was having a baby out through my anus, basically. And your anus is not designed for that.
No.
But it felt like there was a bowling, you were trying to evacuate a huge bowling ball, and it would strike you down. And many times over the last year or two, unfortunately, my children and my husband have found me collapsed on the floor from the pain of it. So I had to go back to the gynecologist again, say things were getting worse. He wanted to put me on the pill. And as I've just explained, I'm not interested in the Band-Aid. I want to find out the root cause. I want to find out what's going on. So that wasn't going to be an option because that wasn't going to cure anything. That was just putting a Band-Aid on the symptom. So he mentioned endometriosis as well, but then he said, but it doesn't really tie in because at the time it could be just one incidence. And I never knew when it was going to strike, when this pain was just going to suddenly hit me. It didn't really tie in. And I questioned to myself, well, no, it couldn't be endometriosis. It just didn't make any sense. Because at the time I didn't know that endometriosis could affect your bowel. So he just prescribed painkillers. And I said, well, God, I don't know when it's going to strike. So I didn't really agree with that notion either. And I wasn't going to be taking painkillers every day for the cycle for when it does happen, because I didn't want to do that either. So when he mentioned the word endometriosis, that's when I started, okay, look, I don't think I have it, but I'll start doing my research. And as it happened, that very next week at work, as part of in pharmacy, you've got to do your CPD and a continuing professional development. And there was a course coming up about endometriosis. And I recognized the name of the guy who was doing it. It was Brendan O'Brien. and he is a nutritional therapist. He's a well-respected nutritional therapist, and he does a lot of work with helping people conceive, or people with fertility problems, because unfortunately people don't realize they have this condition until they go and try and conceive.
Yes.
And that's when they realize that they have endometriosis, because it does unfortunately cause infertility in a lot of people. So when I went on his talk, he discussed about the clients that he had seen and that he had helped. He discussed about excision surgery and the avenues that people were taking that I'd never heard before. He discussed about the Endometriosis Association of Ireland. So that's what drew my attention there. So when I looked them up, I found out that they were having their annual conference. It was coming up a few weeks later. So I booked my ticket for that. Actually, on the way, I remember having to pull in because I had an attack on the way up that weekend.
Wow.
So I got to meet lots of women there at the conference. They had some surgeons that were present. One of the surgeons, he was lovely, Dr. Gabriel Mitrau from Romania. I happened to have a chance to talk to him, and I was just giving him my case history. He said it sounded like, I said I wasn't sure if it was endometriosis or not, but gave him a list of my symptoms. Told him that my MRI was clear, or I was told it was clear, but he offered that he would have a look at the MRI if I could send it on to him. So I did that. He was very kind enough to have a look at it for me. And he gave me a completely different result from what I had been told here, because they're not trained here to read MRIs. You have to have the experience of diagnosing the lesions that are present. And actually, at the time, he told me it was more suggestive of adenomyosis, which is another condition of the uterus, which is a bit more, the only, as far as I'm aware, a hysterectomy is the only option if you do have adenomyosis, where it really penetrates the wall of the uterus. So then I kind of looked into, as things were progressively getting worse, and every month the symptoms were getting worse, I had to look into surgery as an option, because I couldn't go on like this, and I couldn't put my family through it anymore either, because they didn't know when they were going to find me in heap upstairs. But Romania, I was a bit nervous about traveling so far away from home. And I think as a mother, it would have been easier if I was single to travel to Romania. But as a mother, when you've got two kids at home, you kind of a bit more, I'd have to be away from them for a bit longer as well. So I wanted to go somewhere a bit closer to home. So the Endometriosis Association of Ireland, they have a lovely forum where they discuss people's experiences with different surgeons. Nancy's Nook on Facebook, I also highly recommend for anyone looking into this, because she's researched every surgeon in the whole world that has experience. So you can look up Ireland, you can look up England, and get people's experiences of those particular surgeons. So I made an appointment with Mr. Peter Barton Smith in London, had an appointment with him in January, and I had a scan before I had the appointment with him. I had the scan, and as clear as day. It just goes to show the scans here in Ireland were completely different to an experienced eye over there. He could show me the nodule that was present on my bowel.
And that couldn't be seen in Ireland?
That couldn't be seen in Ireland, no. I had been told it was clear there was nothing there. And I actually cried on the table. He must have thought. Oh. And I wasn't crying because of the fact that there was a nodule there. I was crying because, oh my God, I just felt like relief. And I wasn't going crazy. And finally, somebody's actually listening. So...
And just going there, Nicola, when you said, to find that and that relief, because I've heard that from many people, that they've said they've tried and they keep knowing deep down it's not just this, even though everything is clear. And I think that's one thing. It's really listen to your body, listen to yourself. If you really feel there's something else going on, do your research. But when you cried, on the table that day, seeing the nodule, seeing it clearly there that couldn't be seen in Ireland, the relief, but that just shows you what you'd mentally, physically and emotionally been going through for so long. With people telling you there was nothing. It might be this, it might be that, There must be I can just imagine your relief, because again, you hear this story so often. So for you telling this story, I think you're going to give that courage and maybe awareness to other people as well, to say,
I hope so.
Yeah, maybe I should check it out. Maybe I should check Endometriosis Ireland. And what was the name of the lady you said, Nancy?
There's a group on Facebook. It's called Nancy's Nook. It's a group. You have to apply to be added to the group. And there's lots of women on there with all their different symptoms, their different experiences with their doctors, with their consultants, their surgeries and how they are recovering after. So it's a really, really good group.
And the best part of that is that those women have or are experienced that and have gone through the procedures or have found what has worked and what hasn't worked for them. So they are the living, as I'd say it, they're the living research, aren't they?
Yeah, and it's so important. Like it's in sharing it's sharing our stories, as you know, which is why you're doing this podcast. And it's in sharing your stories that you get to learn, and that's how I got to where I am today. If I hadn't spoken to any of those women, and even I was supposed to go for my original surgery back in March, just before lockdown, and then lockdown happened, so we couldn't go. And we were so unsure about what we do, because Peter emailed me in June and he said, I'm opening up my dates again for surgery. Do you want to come over? And at the time, the numbers in England were skyrocket like, and I was thinking, oh Jesus, no, I'll just keep going the way I am and just try and manage it with the way I had been managing it. And it was only through speaking then to 2 or 3 other girls that made their trip in June, and they said it was fine, you've nothing to worry about. If I hadn't spoken to them, I wouldn't have made the decision to finally go in June when I went as well. So it's all about sharing your stories and that connection with others that kind of helps you.
Yeah, so that's what I said, as I said, when I started this, there was a few certain people that I really wanted to reach out and invite them to be guests, because as you know, I watch people's stories. It's not about the big names that are in the newspapers, because we know their stories, but we don't maybe have an opportunity to listen to them in depth, so I want people to see the other person that's in my community, or it can happen to somebody that's in pharmacy, or it can happen to somebody that's a nurse or a doctor, that, we all go through different issues, but we still have to find out a little bit more. It's growing our awareness and doing our research. So then we come to, you're on the table crying with relief, and even to come back and to tell your family or your friends, I actually have this, this is actually going on for me. And now I have a plan about moving forward.
Yes. And that was a great relief to actually have a plan in place.
Yes.
It gave me back a sense of control, I guess. Because surgery isn't the be all and end all. It's not for everybody either. I've as I said in my post on the blog that I did, it's only the beginning really, because when I spoke with Peter the next day after the surgery was done, and you get to see a video. This is another reason why I think I chose Peter, because I love all that stuff.
The curious mind.
Oh, I do. I love all that. I'd love to go into an operating theatre and watch all that kind of stuff going on. Because if I hadn't done pharmacy, I think I definitely would have done medicine. I always have an interest in that. So he showed me the video of the surgery the next day, and he started off his presentation with, this is what a normal womb looks like, and it was lovely and pink and really healthy colors and everything. And then he showed me a picture of what my insides look like, and I was like, oh my God, my face just dropped. It was clear as day what was going on. Like, he did say it was everywhere, but I could see it for myself. It was everywhere. And it just made me realize, I went, oh my God. I said, so that obviously hasn't been going on for a year or two. He said, yeah, this has been going on for years.
Wow.
And it just goes to show, you see, that's the thing. I was always led to believe that my periods were normal. I never ever questioned it. And that's what I really want to advocate now, and try and educate young girls, because periods are not meant to be painful. It's common sometimes there's going to be discomfort, but if they've got to the stage where they're painful and you're taking off work or you're going through mountains of painkillers to get through the day, that is not normal. And I can recall, just looking back on reflection, I can recall 2 or 3 times where I've actually been collapsed on the jacks somewhere.
Yeah, yeah.
In my teens, there was definitely one. In my 20s, there was definitely a lot more, because at that stage I was in college. I was probably not having the healthiest of diets and drinking alcohol, which doesn't help. But I never ever questioned it, that it was meant to be any other way. That was just me. I was one of the unlucky ones. So it just kind of highlighted all that to me. I think it's kind of ingrained into the female conscious that periods are meant to be painful.
But
And
actually,
that's why,
yeah, you saying that, Nicola, and you hear it so often, and you saying it even has kind of struck a chord with me and going, yeah, you see so many young girls and even women, and even I have friends now, and we're in our 40s, and our periods are still painful.
yeah.
And they
Yeah,
have just become so used to the fact that that's just normal. You
that's
should
just normal.
suffer for that whole week of your periods.
Yeah, because
But
you're a
it's,
woman.
yes, but it's
Get
not
on with
normal.
it. It's not
Yeah.
normal.
Wow.
No. So I really want to, like, I'm trying now to target the young girls, because as well as that, it's all about education. It's all about, as I said, the word period. It just, when you say the word period, people just kind of, oh, they kind of
Yeah.
just shudder at the word. There's
And
such
it's
a
so
negative
natural.
aspect to it. Yeah. So it's all about education. I mean, I have to be thankful to endometriosis, really, because it's opened up a whole new avenue of alternative healing for me, because I was lucky enough to do a course this summer now with the lovely Kishi McGuire. She's a yin yoga teacher in Dublin, and she introduced the first Red Alchemy course in Ireland this year, and it's all about menstrual cycle awareness, and being aware of the different phases of your menstrual cycle. And there's another coach on Instagram, Lisa De Jong is her name, and she is a menstrual health coach. And it's all about empowering women to become familiar, to become aware of the different phases of your cycle. Because when you're aware, and you have the information, as I said, you're empowered by this information. You know that there's something wrong.
Yeah.
So that's really, really important.
And
Yeah,
even
sorry,
even when you're talking about, going back to the pharmacy and your body and everything, and we keep touching on this because for me, it is about the awareness, and that knowledge is your power. That's how you
Yes.
empower yourself.
Yes.
And, when you go to whatever practitioner you go to, or GP, or wherever you go, that you understand, you have an awareness of what's going on for you. And I would always say to people, well, note it down like you did, note the pattern, take more notice of it.
Yes.
So that when you go looking for help or support, that you actually say, this is not just now or the last few months, this has actually been going on, and I've been keeping a track of it. So you're very aware of what has been going on in your body, how it affects you, and that they have as much information, because sometimes it's just, again, it's not the doctors, they don't have the time seemingly anymore, but they see somebody for 15 minutes. How can anything be diagnosed in 15 minutes?
Yeah. And I have to say, this is where I know there's a lot of these period tracker apps now that you can get on your phone, and they're quite useful, because it is useful to be aware of the different symptoms as you go through the different phases of your menstrual cycle. There was a study done in 2015 by, let me see now to get this straight, it's the American College of Obstetrics. And they classified your menstrual health as a vital sign. And your menstrual health is a vital sign. It's just like when you go into a doctor, and what they'll take out the stethoscope, they'll measure your heart rate. That's one of the vital signs. Your blood pressure. That's one of the first things the doctor will do, or they should do. But your menstrual health for women, your menstrual health is just as important of a vital sign as your blood pressure and your heart rate.
Wow.
Because that reflects the health of your body. If there's something going on with your menstrual cycle, and you're aware of it, it just kind of it reflects your overall health.
Wow.
So it is really important, and I would really emphasize this to any lady or people with young daughters, to help them become aware of their menstrual cycle as they get. If we had this information when we were in school.
Oh, I know. We were told to shut up, really, and not talk about it, and keep quiet. And as you said, don't mind saying, period. We couldn't say vagina. We couldn't talk about,
Yeah, you
and even
can't.
breastfeeding in this country,
I
it's still
know.
like women feel like they have to hide such a natural and
They
beautiful thing of
do.
feeding and nurturing their child,
Yeah,
even
yeah.
within
And
their own families, don't mind in public. So for me, that's what you've just said there, Nicola, has really even just something's just gone in my brain. Like your menstrual cycle is a vital sign,
it
the
is.
same
Yeah.
as your heart or your blood pressure.
Mm,
That is just after blowing my mind there,
yeah.
because when I actually think about it, it's so true.
Mm,
And
yeah,
we've
it
never
really
been
is.
told that by
We've
anybody.
no, we've never been told. And do you remember the controversy that was there during the summer about the Tampax ad in Ireland and all these complaints that were made? And most of those, I think it was 70% of those complaints were made by women. It wasn't even men. So women themselves were imposing this kind of stigma.
Yes.
Like you cannot talk about periods. It's ridiculous.
Yeah.
It's ridiculous. I had a young girl in a few weeks ago in the pharmacy in her late teens. She didn't even realize that there was only a narrow window in your whole cycle that you can get pregnant. She wasn't aware that she thought she could get pregnant anytime.
Yes.
So
Wow.
yeah, we're not educating our young
No.
girls about our periods, or we just have to get rid of that. We really, really
Yeah.
do.
Where do you think that starts, Nicola? Because again, I know it starts at home by parents being informed and being educated. And, I think if the parents can inform themselves, they can inform their children,
Yes,
their sons and daughters. It doesn't
there's
have to be
something. Yeah.
just about the daughters. I think,
Mm,
as I do say to my eldest, you should be aware of periods and menstrual cycle, and be aware, because if you are going to be with a woman, you need to be
yes.
aware of it. So it's not just a women's issue. And especially if
Yeah.
you're in a relationship, as you said, so many people suffer with fertility
Mm,
issues, that it becomes a whole partner thing. It becomes a family thing, doesn't it? So I
yeah, and
think
it
this,
is.
yeah.
It
So
is.
going back, families, we can't ask teachers to be completely informed about all of this, because they have a education program now where somebody comes in and they teach them the basics, but it's still not enough. So where
Mm.
can we start then, Nicola?
Well, I'm hoping to, as I say, to talk more about this on the blog, because that's what our young people, well, it's what everyone is getting their information on these days, isn't it? It's all here on these screens. I would love to do more in yoga classes with young girls, or even go into schools and talk about this stuff, because it needs to be talked about a lot more. Like I'm seeing at work, I'm seeing prescriptions for young girls going on the pill and all these
Yeah.
pain relievers a lot younger. And young girls these days, they're getting their periods a lot younger than what
Yes.
we got our periods at. So um, this information is really, really important, and it
Yeah.
needs to be out there. Like
Well,
it's funny you say you have to kind of get the whole family involved. Like I can't.
yes.
My mom, I don't ever remember talking that much about periods with her, but maybe she didn't have the knowledge to impart that to me at the time, and a lot of women back then didn't. But
No.
I sure as hell as like funny. Reen says to me like last week, "Oh, you're bleeding, are you, man?"
Yeah.
Like he he knows that now, because we discuss it openly.
Yes.
And I actually got him a book there recently, and I wish this book was around, as I keep saying to him, I wish I had this book when I was your age, about growing up and the changes to expect, not just in a boy's body, but in a girl's body,
Girl's
so
body.
they're aware of it as well.
Yeah. Yeah.
Yeah.
I think that's really important. I think we should know about each other's bodies. I think
Mm.
it's like not just the boy book or the girl book, it should
Yes.
be each other's bodies.
Yeah.
So yeah, absolutely, Nicola, I would agree with you. I think going into schools, and I'm not sure if they let you start in primary school. That's where I believe it should start.
Yeah,
But
I
if you
think so
could,
too.
yeah. But I think what you're incorporating in, as you said, that you're bringing it in with your yoga, with your whole well-being. But again,
Mm.
for understanding that vital sign, and I'm going to
Yeah.
keep repeating that to everyone
Yes.
and say your
Yeah,
menstrual
it is.
cycle is your
Is a
vital
vital
sign.
sign.
And
Yes.
I will emphasize it more. But I think what you said there, it is that our parents didn't have the awareness. They only knew. You're all right. That happens to me too
Sorry,
when I'm
that's
on the
just my
podcast.
That's my alarm to remind me to pick up Eiley from
Oh,
my
you're
story.
all right. So, yeah, I think definitely going into schools and incorporating all of your practices, and educating about the cycle would be really beneficial, Nicola. And I'm sure that we'll see you sometime in the future. So I just wanted to touch on briefly, because again, we spent, this time talking
I
about
know.
but you know what? It's fascinating because I've even learned a load from you. And I think anyone that's listening back, whether it be a male or a female, they may have somebody in their family that is suffering in silence and has been told to just take the painkiller, and maybe they'll kind of guide them into doing a little bit more research. And I'll give the name of the Facebook page and Endometriosis Ireland as well, the link on your podcast, because again, sometimes we don't know where to access this information.
True.
So again, it's always sharing. I always say, keep sharing the knowledge. Even if it's only one person that reads it, that person may need to understand that to help them go forward. So on Instagram, you are the yoga pharmacist. And I was just saying to Nicola before we came on, she has an amazing pose on Instagram, and it's the most amazing photograph. You're nearly like a flower. That's what I see you as when I saw it first. It's kind of in that black and white or sepia color, but it's like you're a flower emerging.
And I feel like I am emerging from a shell in this last, like endometriosis has, as I said, it's brought me down in a completely different avenue. It's really I've had to look at my life, really look at my commitments, look at the way my life balances. I mean, I lecture about this, I talk about this all the time, but putting it into practice in my own life endometriosis is an eye-opener. There's a great, I could talk about this for ages. There's a great guy, Gaber Mate is his name, and he's a physician. I don't know if you've heard of him, but he has a great book, When the Body Says No, and it's all about stress and disease, and how stress causes disease basically in the body. And he would say that endometriosis is the body's way of saying no to stresses in your life that you have not said no to. So it's really, the body is saying, we're not doing this anymore. You just to stop in your tracks and look at your life balance, look at your relationships, look at you've got to do a complete overhaul basically. And that's what I'm in the middle of doing. And surgery, as I said, is step one, but it's only the beginning, really.
It's not the fix all.
It's not the fix all. Definitely not the fix all. No, really
so not. We're hoping to hear a lot more, about your journey. As I said, it's not just about the surgery, it's about everything else beforehand, but especially afterwards, what you're doing in your own life and how you can help. And again, share that information with other women that are going through that journey, to give them that courage to move forward and that hope that, they can come through this, or they can live a really good life, even with this diagnosis, but if they have the awareness of how to help themselves.
Yes.
So in all of that, as I said, I could talk to you for ages as well, Nicola.
And there was loads I meant to talk more about.
But sure, there was loads I was going to ask about. But you know what? It's what we spoke about. I always say, even when you were talking about, you came across this or you did research and it just happened to be that talk was on. For me, that's all, synchronicity and divine timing. When you are ready to take that leap, when you're ready to go a little bit deeper, those people will come into your life. And then it's your choice whether to grab onto it, go forward, learn a bit more, or to stay back and just say, I'll just keep taking the painkillers. That's always going to be our choice. And again, I always say, whatever you choose is going to be right for you. And this is right for you right now. And I can see it in you. And I just can't wait to see more of you talking about it. And hopefully that I'll see you in schools and lots of other places, Nicola, wherever you get the opportunity. And hopefully with this podcast, that you'll get a few more invitations to speak openly and publicly about it with others that really need your support. So I just want to say a very big thank you, Nicola, for coming on.
Thank you so much, Sharon. It's been my pleasure and honored. Thank you so much.
No, thank you for sharing. As I said, I can feel it in my own energy that it's going to go beyond your expectations in being so open. And that's why I say to people, share your story, share it, and let somebody else know that there is another way forward. You know, don't stay stuck. There is always another way
There
forward.
is always another way. Yes,
Yeah.
so true.
Give yourself options. Nicola Heneghan, thank you so much. And everyone can find you at the Yoga Pharmacist on Instagram and your blog, www.theyogapharmacist.wordpress.com.
That's
And you
it.
can get in touch with Nicola through Instagram if you wish, send her a
Yes.
message.
And can I just say, please do not be afraid to message me. Lots of women have after they read the blog. So please, I would love to help if I can. I'd only be delighted to. So yeah, please don't be afraid to reach out.
Good. And if anyone contacts me, I will put them in direct contact with you. Nicola, once again, thank you so much. And I look forward to chatting to you again. We'll come back in a few months or a year and see where you are on your journey. So thank
you, Sharon. Thanks a million.
So thank you everyone for listening to this episode with Nicola Heneghan at the Yoga Pharmacist on Instagram. And I look forward to connecting with you all again in the next episode. Take care and stay well.